This is Dr. Fauci on precisely how this rollout will continue to work.
We at the federal level are going to really partner with the states in a collaborative, cooperative, and hopefully synergistic way, where we're opening up community vaccine centers, up to 500 of them, including in areas that have minority populations that generally don't have easy access to the types of things, including vaccines. We're going to put vaccines in pharmacies, including those located in areas, again, that are underserved. We're going to use mobile units that are going to get out into poorly served areas. We're going to increase dramatically the number of people who will be able to give the vaccination. Regular Army, military people. We're going to get volunteers from retired physicians, nurses, and other healthcare providers in order to get this machine running really smoothly. That's what the president was talking about tonight. That's what he speaks to us in private about. And that's when you see a much more uniform approach of efficiency of getting vaccines into people's arms. That's exactly what he was referring to tonight.
And Dr. Patel, when they talk about uniting the country, they're talking about sticking vaccines in the arms of everyone and anyone that wants one to make everyone that wants one eligible by May 1st. That is a massive undertaking. But to hear Dr. Fauci say that's what everyone talks about publicly and privately, it's clear this is all hands on deck for them.
Yeah, absolutely, Nicole. And what's happening and unfolding locally, even in kind of our area here in D.C., is that you're seeing the states kind of want to match up. The feds have been delivering on getting more and more vaccine supply directly, as Dr. Fauci mentioned. And you can tell the states are feeling that pressure. And in a way, they're creating a competitive environment for a good outcome to get more people vaccinated, all while also trying to keep an eye. We're improving with our numbers of cases, but we had 375,000 cases this week. Dramatic drop from about 1.5 million a week 3 months ago, but we still are seeing, so it's a balance. And that funding from the stimulus couldn't come in time because we do need more people to have this ability to test, to trace, and to vaccinate all at the same time.
And because frontline health workers have had to deal with some of the consequences of the catastrophic messaging of the last year, I want to read this to you, Dr. Patel. This is from our friend Susan Glasser at The New Yorker. President Biden's approach was so different on Thursday night that I suspect his speechwriters rewatched Trump's address of a year ago in order to do and say the opposite. A combative Trump had blamed America's woes on the China virus. A conciliatory Biden condemned anti-Asian hate crimes and spoke of national unity. Trump, a COVID denier whose default setting was to downplay the danger, never thought to prepare Americans for mass suffering, and he didn't recognize those who had perished. President Biden, in contrast, took a card out of his suit jacket and read out the precise number of Americans who had died of COVID-19 to date, 527,726.
Yeah, you know what was chilling? When I listened to President Biden's speech, I thought the same thing, comparing what President Trump said a year ago. And honestly, Nicole, everyone was very happy about what Biden said. I actually had a moment of sadness because I thought if this just could have been rewound a year, and if we could have had President Biden and his team dealing with this last year, we would still have deaths. We would still have cases, but it'd be nowhere near what we're talking about today. And that really is something that I hope we don't forget going forward, because we all desperately want this past year to be behind us. I know I do. But there are some things we should not forget. And what really matters, this was presidential leadership by definition. This is what we expected a president to do. It took us a year to get it.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to you at home.
Thanks for watching.
Thank you so much for letting us into your homes during these extraordinary times.